Hi, this is Dr. Nav Sharda. So people have been asking a lot about what exactly omega-6 does in your body, what exactly omega-3 does in your body, and why we need to worry about it. So the standard American diet has a proportion of omega-6 that's 20 to 40 times as much as omega-3. In other videos, I've explained how evolutionarily our bodies are designed for equal amounts. So a 1-to-1 ratio, and a 20-to-1 ratio versus a 1-to-1 ratio is obviously quite abnormal. So omega-6, it is utilized in developing these compounds called eicosanoids. And eicosanoids are the compounds that your body uses to create inflammation. The inflammation is actually a good thing in limited quantities. Obviously, if it sets up a local inflammation, which causes the natural killer cells and inflammatory cells to come in and destroy the abnormal cancer. So local inflammation is good. But the problem is, with a 20 times or 40 times as much omega-6, the body basically has inflammation signals that it's created all through the body and constantly. So you have constant inflammation everywhere in your body. And the results of constant inflammation, we've absolutely positively proven that any area of constant inflammation will have a higher chance of developing a cancer. So constant inflammation from a very, very high amount of omega-6 increases your risk of cancer. Omega-3, on the other hand, is the pathway that the body uses to make something called leukotrienes. And the leukotrienes are what actually calms down the local inflammation. So, the omega-6 creates a local inflammation to alert the body, and then once the body is alerted, then the omega-3 comes in with the leukotrienes and it calms the inflammation down. So we're in a balance. And really, the balance is essential, because once you get out of balance, your body doesn't know how to respond, and all kinds of bad things will happen. Now, some people have asked, well, why don't I just eat a whole bunch of fish oil to raise the proportion up? Well, I'll tell you what, there's been a bunch of studies that have demonstrated that there is no possible way that you can actually increase your omega-3 consumption up sufficiently to balance the omega-6. The body will not absorb it, you'll get bloated, it's just not possible. There's also some biochemical studies that have shown that after you have 5 or 6 grams of omega-6, the enzymes that would normally be used to create the leukotrienes with the omega-3 no longer work. So it's just not possible to balance the ratio by increasing omega-3. You must balance the ratio by diminishing the omega-6. We talked earlier about how to diminish the omega-6. Primarily, it's the vegetable oils: canola oil, soybean oil, corn oil, safflower oil, sunflower oil, peanut oil. The vegetable and seed oils have an awful lot of omega-6. The only vegetable oil that doesn't have a whole lot of omega-6 is flax seed oil, and that has a whole lot of something called alpha-linolenic acid, which is an omega-3 oil, which the body can use to make some more of the omega-3s. So there you go. Now you know why I am very strongly against omega-6, and I strongly recommend that no more processed foods and limit your consumption of fried foods. So to your health, this is Dr. Nav Sharda.